Hi guys. So let's start with the question of the day. The question goes like, an infant is born with facial dysmorphic and a cleft palate. On evaluation, it reveals a heart condition with right to left shunt and absence of thymic shadow on X-ray. The infant experiences frequent and recurrent sinopulmonary infections. Examination of the patient's lymph node will most likely show poor development of which of the following structures? A. Cortex, B. Paracortex, C. Medullary cords, or D. Medullary sinuses. So in this question, this is a two-step question. First you have to identify the disease, then you have to know which part of the lymph node is affected in this. So let's start with the keywords. The first keyword is absence of thymic shadow on X-ray. So thymus, it produces T cells. We all know it produces T cells. So this disorder is something which is related to thymus, and it is deficiency. Its deficiency causes T cell deficiency. So there is recurrent infections. Why? Because deficiency of T cells. And there is facial dysmorphism, that is abnormal facies. Cleft palate is present, and a heart condition, some heart related. So first we will try to understand the condition. So this condition is DiGeorge syndrome. DiGeorge syndrome. So in DiGeorge syndrome, this is a very important picture. This baby comes in the exams. DiGeorge syndrome. So the mnemonic for DiGeorge syndrome, it is very famous mnemonic. It is also given in first aid, that is catch 22. Why 22? First understand that. Because 22 chromosome is involved, 22q11, and it is micro deletion. It is not deletion, it is micro deletion. So in micro deletion, the investigation of choice for DiGeorge syndrome becomes fish. So this is also a PYQ. So what happens first of all in DiGeorge syndrome? So this is a very important image. We all know about this image. These are the pouches and the clefts. So in DiGeorge, the third and the fourth, from 2 to, then you have to learn 3, 4. Third and the fourth pouch is affected. What third pouch is making? Third pouch is making eye, so inferior parathyroid and thymus. The fourth pouch is making superior parathyroid. So that means there is deficiency of parathyroid gland as well as thymus. Parathyroid and thymus. Thymus will produce T cells, and parathyroid, it produces calcium. So here there will be deficiency of calcium. So H is hypocalcemia. Why hypocalcemia? Because due to deficiency of due to parathyroid aplasia. So it causes tetany. C, you have cardiac defects. What cardiac defects? Like tetralogy of Fallot and truncus arteriosus. From A, you have abnormal facies. So what happens in abnormal facies? You can see there is absence of, there is small jaw, small upper lip and mouth, cleft lip and cleft palate are present, low set of ears are present, so and short stature. So this picture is very important. A is abnormal facies. T is thymic hypoplasia. Why? Because the third pouch is not well developed. T cell deficiency, and C, cleft palate and hypocalcemia. Because of T cell deficiency, there are recurrent sinopulmonary infections. Okay, now we know now it is T cell deficiency. Let's go ahead. So this image is showing absence of the thymus tissue. Thymic tissue is absent. Investigation of choice is fish, I already told. Now it is asking what. It is not asking whether it is T cell deficiency or it is DiGeorge syndrome. It is asking examination of patient's lymph node will most likely show poor development of which of the following structures. That means that the lymph node produces both B cells and T cells. Now we need to know about lymph nodes. So lymph node, it is a capsulated structure. First we have to learn that it is a capsulated structure. It has two parts, medulla and cortex. So like this is a lymph node. So lymph node has two parts, the concave part and the convex part and the concave part. So this part will contains all the afferents. The afferents will come, and this part is known as the hilum. The hilum will contain the efferent. Here we have the efferent. In the center, you can learn like this. In the center you have the medulla, and here you have the cortex. Outer is cortex. Cortex is divided into two parts, the outer cortex and the inner cortex. That is, let me show you. So this is all outer cortex. This is outer cortex and this is inner cortex. Okay. Inner cortex, it is also known as paracortex. The outer cortex have follicles. Now follicles are of two types, primary follicles and secondary follicles. Primary follicles are dense and they are quiet, they are quiescent. Secondary follicles have pale germinal centers and are active. So secondary are active and primary are quiet, they are dense. Now medulla. What happens in medulla? Medulla have medullary sinuses and medullary cords, and medullary sinuses, they communicate with the efferent lymphatics. Medullary sinuses. Medullary sinus, what do medullary sinuses have? They have reticular cells and macrophages. And reticular cells produces type 3 collagen. What it produces? Type 3 collagen. And because of that type 3 collagen, the lymph node is being made. Now what happens? What is they present in paracortex? In paracortex we have T cells. So T cells are present in the paracortex. It is the region between the follicles and the medulla. I told you it is also known as the inner cortex, and it contains, and it is underdeveloped in patients with DiGeorge syndrome. And paracortex, one more question can come, it enlarges in conditions like Epstein-Barr virus and other viral infections. So the lymphadenopathy, when we say the lymph nodes are swollen, that is due to paracortex hyperplasia. So this is a very nice question, because here we have learned about DiGeorge and the structure about the lymph node. So answer is paracortex, that is the answer is B. So we should all know about the structure of the lymph node. Afferent vessels, efferent vessels, it is capsulated, and the reticular fibers, everything. Thank you guys. See you tomorrow with another question. Thank you.